So what are the important guidelines for screen exposure in a child less than 5 years of age? So we all know that autism is on its spike. It is increasing exponentially worldwide, not only in India but worldwide, because of multiple risk factors, and out of which very important is screen exposure. So we should all understand what is healthy screen watching, how much should we give to our child, and what are the guidelines when we give the screen exposure to our child. A very important guideline is by the American Academy of Pediatrics that between 0 to 2 years there should be no screen exposure. Totally no. Screen means TV as well as phone. So no screen exposure between 0 to 2 years of age. What about 2 to 5 years? So 2 to 5 years is a broad age group when the child is developing, child is growing, more intelligent, more interactive, going out to the world. During this time you can introduce screen, and the recommended time is 1 hour per day on a weekday, and it can be up to 2 to 3 hours in a weekend. But with the disclaimer. So what is the disclaimer? So number one thing, it should ideally be in a broken segments. So not at a stretch 1 hour in one day. It can be in short 2 to 3 breaks. Second, do not associate it with meal or sleep time. So खाना खाना और sleep, ये दोनों events के साथ में do not add your screen. So अगर बच्चे को रोज आप खाना खिला रहे हैं and TV देख के खाना खिला रहे हैं, he will forget कि बच्चे को खाना ऐसे खुद से खाना है, without screen exposure खाना है, even at a later age group. So बच्चे का जो फूड के साथ रिलेशनशिप है, जो एक टाइम है when he can bond with you, he can interact with you, वो टाइम खत्म हो जाता है. When the child is at screen, बच्चा बिल्कुल एक रोबोट की तरह होता है. You are just feeding something to your child's mouth which he doesn't know what is the taste. क्या खा रहा हूँ, क्या टेस्ट है, कुछ नहीं पता बच्चे को. So do not associate it with meal, with light, with sleep. What happens when you give a screen? जो normal sleep hormone है, melatonin, it hampers the production of melatonin. It has lot of sleep side effects. It has lot of hormonal effects. So अपना melatonin, dopamine, all the other neurotransmitters जो कि normally एक sync में होते हैं, एक development में होते हैं. When you give screen exposure during the sleep time, during that dark hours, the child will have problems in normal hormonal production, and it will affect the child's sleep and behavior. So screen exposure during meals and sleep, it's a big no. Third important thing is कि screen हमेशा co-watching होना चाहिए. So it should never be कि बच्चा screen पे है and he's all alone. The mom is busy in the kitchen, the father is busy in the office work, and the child is alone with the screen. So that is as good as giving poison. So वो एक टॉक्सिन की तरह होता है. बच्चा स्क्रीन पे है, अकेले है, सिर्फ स्क्रीन और बच्चे बातें कर रहे हैं. There is no stimulation. It is one-way stimulation. So do not do this. It is always co-watching. A parent or a caregiver should be there. क्या चल रहा है स्क्रीन में, बच्चा कैसे कर रहा है, उसकी क्या अंडरस्टैंडिंग है, कुछ डांसिंग है, कुछ गिगलिंग है. सो एक्ट विद योर चाइल्ड, आस्क क्वेश्चंस कि क्या कर रहा है, what is happening, and let him share his joy and experiences. So you both should be enjoying that TV time, not that you are associated with food, not that it is associated with sleep. So let us recapitulate once again. One is screen timing का प्लीज ध्यान रखें. 0 to 2 years no screen, 2 to 5 years screen up to 1 hour in a day. Other point is in breaks, not all together. You should give that 1 hour at a stretch. Third thing, do not associate it with a meal or with a sleep time. The fourth thing is co-watching is allowed, and co-watching is appreciated rather than giving the screen in alone or in isolation to the child. So that will help in certain circumstance for a child's brain development, in understanding, developing relationship, the human relationship. So that will avoid lot of our children to develop autistic features, and will have a better tomorrow. Thank you.